Okay, well, hi everyone. Thank you so much for joining us today. My name is Bahar. I'm the Vice President of the Maternal and Child Health Student Association here at UAB. I just want to welcome you all to our seminar, Engaging in State Advocacy Work, What to Do When You Didn't Get a Political Science Degree. Our speaker today is the Director of Maternal Infant Health at the March of Dimes and heavily involved in state advocacy work. Please help me welcome Honor McDaniel.
Thanks, Bahar. It is great to see all you guys, and I'm excited to talk. Yeah, I really am excited about talking about advocacy and advocacy. I'm specifically going to talk about Alabama, since UAB is in Alabama. If you're not in Alabama, don't worry. A lot of this carries over to other states. However, I would encourage you to take time and look into your state's structure, and some states kind of their meeting times are different for state advocacy, things like that. So I would encourage you also, as we move through, just think of it in the context of the state you're in. And so as the title might say, I did not get my degree in political science. This is my information. I just wanted to start out so that in case you just want to add, sometimes at the end you don't get it down quickly enough. So while I talk about myself, there's my information. But I did not get a political science degree. I got a public health degree in my undergrad, and then I got my master's in public health as well, in healthcare policy and leadership with maternal and child health focus. And even then, policy and leadership, you'd think like, oh, that's political. No, it's about kind of agency, like the structure of the maternal and child health world. It really doesn't talk strongly about advocacy work. They say, oh, advocacy work might be part of your job, or advocating is important, but you don't learn what that looks like, what that means. So I really learned by doing. And if you're in a social science degree, what you'll find is you will probably wear a lot of hats in any role you're given. And you may go in thinking I'm going to be a program manager, and then all of a sudden they're like, by the way, you have this thing I need you to advocate for. If you're working in the nonprofit world, advocacy is always going to be a part of your conversation. So sorry if you can hear it, my dog just went behind the blinds, so you're going to hear him throughout me talking. He will also probably talk. But if you're in the nonprofit world, it'll be a big part of your budget, figuring out how to get that money coming in, either through a state budget or through connections in the political world. So this is my perspective of it. This is what I have learned in what I have been doing. That being said, I'm always learning more. I'm always changing. I'm always finding out new strategies, new thought processes, the details. This is going to be a really big overview. There are so many details that go into advocacy work, state legislatures, like all of that stuff. So if you see something, you're like, well, actually, like, yes, it works like that, but also there's so much more to it. Yes, you're absolutely right. There's so much more to what I'm going to be talking about. But, and you don't want to go too much in detail within an hour. You can't digest all that information. But if you have any insight, please feel free to share it in the chat, or we can talk about it after. I'm continuing to learn. I'm continuing to find out what really advocacy looks like and means, and that changes as the landscape changes in Alabama as well. So March of Dimes is the nonprofit I work for. It is a national nonprofit with local market influence. So I'm in the Alabama market. I'm over all of our initiatives in the Alabama market that have to do with our mission. Overall, we focus on the health of all moms and babies. And when we do this, we really focus on making sure that health comes regardless of wealth, race, gender, or geography. So that is going to look like infant mortality numbers, maternal mortality or morbidity numbers, and preterm birth rates. And we do that all through a health equity lens, make sure that's built on health equity. And that really comes with a lot of different thought processes, different players. It's not siloed. What we find out in a lot of the work, even if you're not in maternal and child health, if you're in another world, I'm sure you can be like, yeah, life isn't siloed. Your health is affected by your job. Your job's affected by your health, your income, your place you live, the street you live on, you know, who's around you, what your neighbors like, all of that interconnects. And so that means that we really kind of think of in March of Dimes, we're like, how can we affect those numbers, but continuing to ask why those numbers are high in Alabama. So why do we have infant mortality? Well, because we have high preterm birth rates. Well, why do we have high preterm birth rates? Because we have a huge portion of our population that's not covered by health insurance, or they live rurally and live in what we call a maternity care desert, where they don't have an OBGYN or a birthing hospital. So you can continue to ask those why questions and get back to the root. And that's where you see legislation come in. So as I go through this thought of, okay, you're told that you're advocating for state legislators. I want to set the scene and have this in your mind as you're going forward, because it'll kind of help you navigate through that. So we're going to talk, when I talk about, you know, state legislature and what it looks like to, what advocacy, when people say advocacy, what that really looks like, we're going to use the example of House Bill 28 in Alabama. This is a bill that March of Dimes is trying to get through this legislative session, which is currently happening until April. So all of our legislators are coming to Montgomery during the week to talk. And this bill specifically looks at the shackling of pregnant women in our correctional facilities. In the state of Alabama, a pregnant female or a female who is in the immediate postpartum period, that's 6 weeks after birth, can be shackled to the bed while she's giving birth. Let me just tell y'all, she ain't gonna run. She ain't gonna do nothing but push. So this bill really focuses on maintaining the dignity of that pregnant woman while she's in our correctional facilities. The processes that she will go through to make sure that all of her custodians know that she is pregnant, and the protocol, and a processes of which she can report if she has been had any of these things done to her. A processes for these custodians, that's the people who are in those facilities helping these women. If they decide that there are things that let that woman have these, you know, have a strip shirt done or restraints or a medical exam done for her. But they have to report that if they're like, okay, we decided that this is a specific situation that needs that. So all of those things are being outlined in this House Bill 28. So we call it the anti-shackling bill. So think of that as you walked into a new job and they're like, oh, that's so awesome, you're gonna run this program. By the way, we need to advocate for this House Bill 28. Congratulations, you're in charge of it. And you're going, okay, I was never given a political science degree. I have a social sciences degree, or I even have a clinical degree. And I haven't been walked through exactly what advocating means. Like in the back of my mind, I know it's educating people. I know it's using my voice, but what's the applications that make you advocate for this bill? So keep that in your back of your mind as we move forward talking about what state advocacy looks like. So Alabama state government, most state governments look like Alabama. So if you remember, when we were kids, they went through the 3 branches of government: executive, legislative, and judicial. We aren't going to talk about judicial today, but those are like the national. State is reflective of the national. So in Alabama, when I'm told, okay, we're going to advocate for this House Bill 28, I think, okay, there's 2 branches that I need to be aware of. You have the executive branch, that's the governor, Governor Kay Ivey in Alabama. And underneath her, she has her cabinet that she's appointed that is made up of all of the state agencies. So state agencies like the Department of Commerce, the Department of Agriculture, you know, so on and so forth. Little different in the state health board, things like that, where you have those state agencies where you know that they do things, they implement things in the state. So her cabinet is made up of all the heads of those state agencies. So I'm in my mind, I'm like, okay, I have those people. I have the governor and her cabinet members, those state agencies, and then I have the legislative branch. And that's the upper and lower house. That is our senators and our House of Representatives at the state level. So none of this is the people, they ain't going to Washington, D.C., they're going to the capital of your state. So the way that Senate and House of Representative members are elected, very similar to national. Senate gets a certain number for each of the districts, whereas House is based on population. So we have the Senate, we have the House of Representatives. There's going to be less members in the Senate than the House of Representatives, but we're like, okay, so these are people that are going to Montgomery from Huntsville, from Birmingham, from Tuscaloosa, from Dothan, like they're from all over the state. They go to Montgomery to make our state laws. And within each of those houses are these committees. So each of these members that we've elected as Alabamians, they'll meet all together, but then they'll break up and they'll go to these committees to focus on specific issues. So let's say that I get elected to the Senate. Well, I have a background in health. So because I have that background in health, I'm going to say I want to be on the health committee because I have insight to that and I want to help really look deeply into the laws on health. So each Senate member and each House member goes and is part of these committees. So now we're like, all right, so I now have this House Bill 28, and I've been told I'm in charge of getting it passed. I know that it's going to go through the legislative branch because it's a bill, but I don't really remember how that works. So this is how it goes through. So House Bill 28 was introduced to the House of Representatives and read for the first time on the first day that they met, and then it's been sent to the committee that it matches. So because House Bill 20, and you can kind of find out what committee a bill is being sent to online, but it's kind of easy to be like, all right, so House Bill 28 really has to do with our legal system, our correctional facilities, our justice system, right? So it's going to be sent to the Judiciary Committee, the committee that looks at justice, the branch of government for correctionals, the justice system, things like that. So it's going to be sent to that committee. So that committee will look at it and they'll be like, okay, we want to make these revisions, or we want this wording changed, or nope, not going to happen. We're killing this bill. It's not going to move forward. Once the committee talks about it, makes changes, whatever, they go back to the House as a whole and they read it again. And then they all come together and the committee says, this is what we think of the bill. It either is not one we support, or we support it if we want, but we made these changes to it. And this is what we think everyone should do. And usually the House is like, sounds great. Thank you so much for taking the time to look at that bill. We'll do what you say, vote on it. So once it passes in one house, so let's say it passes in the House of Representatives, it then has to be sent over to the Senate to the exact same thing. So it goes through the exact same process. If that other house, so the Senate, looks at it, that committee over there, same thing, Judiciary Committee in the Senate, they look at it and they're like, yes, perfect. We love what the House has done on it. We're good with it. Let's send it to the governor to sign into law. Awesome. Done. Perfect. The governor can sign it or the governor can't, depending if the governor wants to veto, governor can veto. But they're like, great, awesome, we did that, and it goes into law. It gets complicated. If the Senate wants to make changes, it has to go back to the House, so on and so forth. So it does get messy. But that's pretty much what this bill is going to go through in order to come into law. So when you're looking at this, you're like, okay, gosh, how do I influence that process? Like that's a messy process. There's so many steps. How am I supposed to do that? And I don't, again, like I'm not a political science major. Like all I know how to do is I know that this bill is good. Well, this is kind of what I've learned as the thought process of what I do for that bill. I found out what house that bill is in. If it's an HB, which when we're thinking of this, we're thinking of House Bill 28. So that's House Bill HB 28, or SB Senate Bill, and then the number of that Senate bill. So you know which house that it is originating in. And you're like, okay, what committee is it going to? And you kind of want to know which committee it's going to on either side, because it will have to go to that same committee in that other house. So who's the chair of that committee? Who's the vice chair of the committee? Which one of those members are on that committee? So in the Judiciary Committee that this bill is going to go to, who are those House members that are on that committee? Where are they from? What's their background? What are they passionate about? And you kind of find that out where you're like, okay, this is the chair and vice chair of the Judiciary Committee, and I need to talk to them. I need to tell them how important it is for this bill to move through and get passed as law. So, but what you have to realize is this chair or vice chair may not be from where you're from. So let's say the chair of the Judiciary Committee is from Dothan. I'm not from Dothan. The people that these members of these two houses care about are those people who are going to get them that have either gotten them elected or could get them elected in the future. So those are those people that live in their area that votes for them. So then you're like, great, okay, so I know that the chair of the Judiciary Committee is from Dothan. Do I have any friends, supporters, clients, anyone who's from Dothan who can help me talk to this person, that they can say, hey, I'm your constituent, I want to meet and have a conversation, and they'll see, oh, I'm a constituent, yes, absolutely, I will speak with you. So you can rally the troops, and again, remember that you're thinking of the chair, the vice chair, and anyone else who's on this committee, right? So you're like, okay, I have this committee that I have 10, 15 different House of Representative members on this committee. Let's see how many supporters and friends I can get to come with me to go meet with these people, and can I match them up based on the senator that's from Dothan can go with my friend who's from Dothan. The person from Montgomery can go and talk to the senator that's from Montgomery. So you're having these people meet with their representative, so that this is coming from someone that could influence whether this person is in office. So you kind of get those meetings started, you get that conversation started, and usually that happens in one day. It might be an advocacy push where you're doing it over a long period of time. And you yourself, as a representative of your organization that's pretty much said, hey, it's your job to go and advocate, you also want to meet with that chair and that vice chair, even if you're not from the same place. I have a contract lobbyist, so I have someone who spends all of his time in Montgomery being friends with all of the legislators, and just meeting with them on a normal basis to keep them up to date with what is important to March of Dimes, that March of Dimes is still here, things of that nature. And he also works on getting that agency on board that would be affected by this bill. So if we go back, we see that there's state agencies and then there's the Senate. Those state agencies, the legislative branch may put that bill into law, but the execution of that law is going to go to that state agency. So they're going to be affected by your law. If that state agency comes to the legislative branch or says, we don't like this bill, we can't put it into law easily, it's just not, we don't like it, we're not for it, we're not on board, that is a huge issue for the legislative branch. Both of those houses are going to be like, oh my gosh, the state agency doesn't like that bill. So for House Bill 28, if the Department of Corrections doesn't like House Bill 28, it is not going to get passed. So what myself and my contract lobbyists do is we set up meetings with them and make sure that they like the bill, like help us craft this bill. This is our goal. What about this bill don't you like, and how can we word it so that you will approve of it? Sometimes that works really well, and for this bill that did, so that they can say, okay, we will like it if you put this in there, this in there, this in there, and this in there. If you put this language, and we're like, great, we accept that, those revisions, we'll put it in there. But sometimes they're like, there's nothing you can do. So you have to also advocate at the state agency level to get them on board. So you're meeting with those representatives saying this is a great bill, while you're also meeting with those agencies saying, how can I get you on board to like this bill? And then you're just having those conversations. And this is what grassroots advocacy looks like. Grassroots being you're getting that support from those people who live in that area and pushing it forward. So March of Dimes is in the process of doing this. We do this every legislative session. We have our own set of legislative priorities that we're pushing. And so what we're doing is we're having a big push one day on March 9th in Montgomery called March for Change, where we're going to the State House and I'm setting up meetings with all of the committee members for House Bill 28, for the process, some of the committee members who oversee our budgets, and things of that nature. So we're doing this all for March of Dimes on a specific day, but that doesn't mean you aren't still pushing people to have these conversations throughout the entire year. Some of the best times to talk to state representatives is after the legislative session, because they have more time, they're at home, they can help you plan for a bill for the next general session. So you have all of these moving pieces, but in the end, it's just a strategic conversation that you're having, informing and educating lawmakers about what's important to you, to your organization, and to those who live in your state. State advocacy is very different than legislative or national advocacy, because you have less members to deal with. You have less, usually you have less bills to contend with, so you have more time to talk to your legislators, and for less, they have less things to really split their attention. You have better reach to state people, because you're like, hey, I just need you to drive over to Montgomery an hour and a half instead of drive to Washington, D.C. So you kind of have these advantages in state legislation, especially in Alabama. So if you're interested in coming, that's a QR code to our March for Change in Alabama. We have different March for Change throughout the entire nation, with looking at our state legislators. Most of them are on March 9th, where they have their own set of priorities based on what's happening in their state. And you can go to marchofdimes.org to look that up. But I wanted to invite y'all and say you can come with me and I can walk you through what we're doing. I know that this is kind of a process that's like, you kind of have to watch it over and over again, or look through, think through like the steps over and over again until it becomes second nature. So I'm happy to email that to anyone who wants it. So here's my information again. But I wanted to leave enough time for conversation and for questions, because I know that this can kind of be an area that is a little daunting. But once you get into it, it's so fun and heartwarming to hear stories and to meet people who really do care about what's going on in your state.
That's outstanding, Honor. Thank you. This is
Welcome.
a great opportunity for y'all to ask some questions about advocacy, about the March of Dimes. If you are having trouble unmuting yourself, just let me know and I'll do it from my end, but fire away.
Yes. And I also, if you have other issues that you're interested in, state advocacy wise, in Alabama, there's an amazing coalition, and I'll put them, it's Alabama Arise, and they can keep you up to date on all the stuff going on in the state, different bills, and they have a lot of great resources as well. So if you're like, House Bill 28, not my cup of tea, they have a lot more policy stuff as well.
I was going to ask a question.
Yeah.
Do you have any tips on how to handle it if you go in to speak with someone and they just are immediately against your issue or your topic? Do you usually just kind of have to accept maybe this, I'm not going to get this person on board and use your time as with someone else, or do you try to continue the conversation, or how do you handle that situation?
Yeah, rarely I think are there state legislators who are going to be so against an issue that they just cut you off. If they're like that, you gotta roll with the punches and pretty much be like, we can agree to disagree. I would love if you took some time to usually you leave them with something. So usually it's not more than a 1-page document, but you leave them with something and say, I would love if you or one of your staff members would look this over. And if there's any way that we could have further conversation on, why you don't like this bill, the way that we could work together to work on this issue. So even pull it back to the issue as a whole. So if someone's looking at me and saying, well, I don't believe in Medicaid expansion, because that's a big thing for March of Dimes, Medicaid expansion, and be like, okay, so let's talk just about what Medicaid expansion does in general. Is it gets healthcare to those to a group of people who usually don't have access to healthcare. So let's talk about what your ideas are to alleviate that issue in this state. And that's kind of a common playing ground, because you won't really find someone who's like, oh, I'm against alleviating hardship on people, or you won't really find someone who's like, I'm against alleviating poverty. Like there will not be like a state legislator who's like, yeah, I don't really care about that. They really shouldn't be in state government, but you really won't find those. So I wouldn't even stop that conversation. I would kind of use it to your advantage of like, okay, then let's have a productive conversation and brainstorm. But I mean, I think that depends on the person talking. I bet some of my colleagues would be like, no, you cut and get out. So I think that also depends on your personality.
Hey, Honor, it's me.
Hi.
How are you?
I'm good. How are you?
I'm well. It's my first meeting being back in a long time. Glad to see you. But I wanted to ask, because I know you brought up like project management, and like I know that when I think I last spoke to you, you were like, I'm gonna go possibly pursue my doctorate, and then next thing I see, you're in this really big position right now. I'm so happy for you.
Thanks.
But how was it, or has it been in like trying to find a position where we still use our MPH, but like not in the way that you used with this presentation, like
yeah. Yeah, so I'm still interested in looking to pursue my doctorate. I'll probably do it while I work, because this position came along, and I was like, ooh, that sounds amazing, I totally want it, and then I applied. I actually think that because of the boom in number of jobs, it's getting easier to find positions that are useful with your MPH. You have to realize that your MPH assists you, but doesn't define you. So you might find a position that, oh, my MPH prepared me for 60 or 70% of this job, but there's still, 40, 30% that I have no idea what I'm doing, or it really isn't in my wheelhouse. I'm not really excited about it. But you learn and you grow. And you find out that in order to make a program work, there's more than just the MPH focus. So for like March of Dimes, for example, I do a lot of initiatives, programming, things like that, but I don't do direct service and I don't do direct programming. I do programming on a systematic level, and not direct one-on-one like a community program. And, figuring that out is really hard for me because I'm like, well, in my MPH prepared me for one-on-one boots on the ground work as well as systems work. Part of my job is helping create revenue for the company because, we're a nonprofit, we have to find revenue. And so being in those conversations with people who might have grants or things like that. And so that would be my answer, is that looking for a job for an MPH, I'm so thankful I have it. It's helped me get my job. I would not have my job without it. But you gotta take that 30% or whatever it is, depending on the job, that you're like, that's not exactly what I wanted to do. Well, you can't, you'd be lucky if you found a job that was everything your master's was.
Right. Yeah, exactly. That's what I was thinking. Because I think it's because I'm graduating soon and I'm like, man, like I'm trying to be like honor. She got herself a good job. It's over. And it's with a nonprofit. That's like basically what our whole degree has been on. And then
I'm very lucky.
Your experience. So I'm like, okay, so just being open to the fact that, we're using it aids us. But it's not our end all be all.
Right. And there's so many different, and any degree that you guys are getting, there's going to be so many avenues that you can go down with that degree. That's why there's a diverse number of people who are at the university too, to teach you all these different courses. So, I could have gotten my MPH and gone into health economics. I could have gone into academics too. A lot of people go into academics. And you might start out in one place just because, hey, that's a job, I can use my MPH, and then you transition to another place. But I think that open-mindedness when it comes to looking for jobs is very useful when moving and giving yourself time to learn. I had no idea what I was doing with state advocacy when I first got this job. And I've been so thankful for community partners and my lobbyists who have taught me so much about state advocacy and government work, and working with lawmakers.
Honor, thank you. That was really great. I had a quick question, and it may just be like, so you work for the March of Dimes. So when y'all are the HB 28 that you were talking about, so was that something that y'all came up with and created and then you went to representatives with, or was it already on the table? I'm trying to figure out, did somebody reach out to y'all, or did y'all create it and then take it to the state government?
That's a great question. So House Bill 28, definitely the woman who was in my position before me, huge proponent of this, helped with all the wording, was giant piece of getting this on the table. But she did so because she sat on committees and task forces looking at pregnant women in correctional facilities, women with substance use disorder, because women with substance use disorder in Alabama do get thrown in jail. Is a criminal penalty for those women. So she sat on all of these boards, and she and her partners were talking, and they said, if we could just get this changed, this passed, that is something that would be a great and huge step. And you're going to be, we were sitting, I sit on those task forces and boards now, and we sit there and we all have different skills, different things we can do in our position. March of Dimes is lucky enough that we can participate in governmental affairs. And a lot of our partners are either government entities or, we're universities or private institutes, things like that, where they might not have the time, the capacity, or the workforce to do that. So I would say she went to she, as a representative of that bigger partnership, went to a legislator who has put forth stuff like this beforehand and said, what would you think about doing something else? Yeah, sorry. Are y'all getting the tornado running at the same time? Yeah, okay. We'll give it a second. So that's kind of the behind the scenes, is that usually it's a group of people, and then they either form a coalition. What you'll hear about is a lot is coalitions are very powerful. What you'll find is legislators love special interest groups, which are going to be like the American Hospital Association, us, you know, like what you normally think of as special interest groups. They're going to care what we think. Like they're, especially the special interest groups that are able to give them money. And coalitions, and that's people who come together and go and do a, yeah, also hearing the sirens, and who do a coordinated push. So it might look like, you know, Britta was the one, who's the girl who's before me, came forth in March of Dimes, did that, but it was really a coordinated effort with people behind her saying, okay, you're going to do this, you're going to do this, you're going to do this, and you're going to do this.
Thank you.
Yeah, but then there's also other bills that we just get behind, that we hear about and we're like, yes, we'll be part of that push as well. So that really depends. A lot of what happens budget wise is that's what happens with us, is we don't usually make budget asks, and we just ask someone else to, or someone else does it, and then we're like, we agree. I will say in the state of Alabama, I didn't say this before, but the way the budget works is a little bit different than a bill. There are two budgets in the state of Alabama, the education and the general budget. So general budget goes, you know, has things that are general. Education budget goes to things that are educational throughout the state. And they both start in a separate house. So they both don't start in the Senate and they both don't start in the House. One starts one starts the other, and they go through the same process. So there is a committee for each budget in each of the houses.
How are you feeling about HB 28? Do you think it?
I'm feeling good. Yeah, we've worked on this for years. We have the backing of the people we need to have backing for. We did go to them and say, what are we going to need to get you to sign off on this? Because we need the Attorney General behind us. We need the Department of Corrections behind us. And so we worked with them to draft the language. And so I'm feeling really good about it. It's just more, can we convince them that that should be a priority? You know, there's only so much time that they have that they can talk. And sometimes these bills just don't make it through because of all the other stuff that's going on. So it's been a few years that we've been trying to get this passed, just because it hasn't been a priority for the legislature to push it through. Each year they all come up with the legislature, and Governor Ivey will come forth and say, these are our priority areas and these are what we're focusing on as we go into this general session. It just hasn't been one of the topics that's been talked about. So I'm feeling good about it. But that push on March 9th will be a huge help of people saying this is important. We don't want our pregnant women shackled to beds while they're in labor. Thank you.
All righty. Well, I think I'm going to close this off a little early just because of the weather. And Anna, you've done an amazing job with all these.
It's a complicated process.
Yeah. But thank you all for tuning in, and you'll be getting more from us soon. And Honor, thank you so much for presenting this incredibly valuable information.
Sounds good. Yeah, thank you guys.